Hello, and welcome to Better Health. I'm Dr. Bobby Stowe, and this show is about you, the audience, the patient. In the next 30 minutes, we will explore, answer, and hopefully intrigue you to think about complementary and alternative medicine, the role it can play, and how it can be utilized as a viable option in the treatment of many medical conditions. If you saw our last show, I hope you got a taste of how and why your gastrointestinal tract is so important in your overall health, and how an imbalance in that GI system can have a tremendous and potentially dangerous effect on your health. Dr. Arlen Hill was our special guest and explained how the standard American diet of processed foods, along with inflammation, and how they're having such a tremendous negative effect on our overall health by attacking our own gut and actually turning it against our own immune system. So it is with great pleasure that I tell you that Dr. Hill has graciously accepted our invitation to return to our show to continue to teach us about our GI system and how a dysfunctional, diseased gut can be the ultimate reason that so many Americans are becoming ill and dying of preventable diseases. Please understand that many of these diseases that we are about to speak of can actually be prevented, but it will take a personal effort on each individual taking personal responsibility for your own health. What we all want is to live a better and more healthy life, free of disease and pain, and the gut just might be the best place to start. And speaking of health, let's define what I believe health really is. Health is not merely the absence of disease, but rather a homeostatic balance of the systems and processes of the body. It is the harmony of the 12 systems of your body that allows the body to function in a healthy manner and hopefully prevent disease. Again, this show has been designed to provide you with the information that you can use to be better informed about achieving and maintaining your health. Many times there are alternative methods available for a given condition, and it is my desire to inform you about these treatments and therapies, and as we all strive and seek better health.
It's exciting and bold, yet classy and comfortable. It's the Tom Felicia Home Collection that puts the finishing touches to your perfect living environment. James Craig Furnishings in Houston offers the Tom Felicia Home Collection, along with other fashion-forward home furnishings, fit for every lifestyle. They offer the designs you want and the service you deserve. Visit James Craig Furnishings.
Welcome back. Today in the news, a report was released on August the 29th, 2011 in the British Medical Journal that links the potential benefits associated with chocolate consumption and a lower risk of cardiometabolic disorders. In other words, cardiovascular disease. This report showed that individuals who ate the most chocolate had a 37% lower risk of cardiovascular disease and a 29% lower risk of stroke compared to individuals who ate the least amount of chocolate. The biggest surprise to the author was that it made no difference as to what type of chocolate you ate, be it dark, milk, or white. It was also stated that it didn't matter what form the chocolate was consumed in, like chocolate bars, drinks, snacks, confectionery, like biscuits, desserts, even nutritional supplements. Chocolate consumption was reported to range from never to more than once per day. So for all those people out there who've been hiding when they eat that chocolate, Never fear, research now tells us that it is actually healthy to consume a little chocolate, and it doesn't really matter what kind you choose. But on a personal note, I have to add one caveat to this report, and that is too much of anything can be unhealthy. So remember, just not to go overboard when eating this fabulous and now healthy nutrition. Our second news article comes to us from the American Journal of Medicine, published in July 2011. In this study, it found that older patients with hypertension and coronary arterial disease who use non-steroidal anti-inflammatory drugs, or NSAIDs, all the time to control pain are at a significantly increased risk of cardiovascular events. NSAIDs such as ibuprofen and naproxen were the most common type people were taking in this study. Another significant aspect of this study was the number of people taking part, which was about 900 patients who were identified as taking NSAIDs and were termed chronic users. Most of these patients were taking the NSAIDs for other conditions such as rheumatoid arthritis, osteoarthritis, and even low back pain. The big finding in this study was that those patients listed as chronic NSAID users, they more than doubled their risk of death from some cardiovascular event compared to those patients who infrequently or never used NSAIDs. So what is a patient to do if you're taking these NSAIDs and trying to deal with pain? Well, the article suggests patients turn to acetaminophen, like Tylenol, as the first-line agent in their efforts to control pain. But as a holistic provider, I would suggest that you first turn to a doctor who is competent in trying to find the cause of the pain and treat the cause, thus eliminating the need for this or any other type of drug, NSAID or otherwise. This, to me, is the epitome of health and healing. It makes no sense to continue to treat a condition using drugs when the underlying cause is not being addressed. Our last report comes to us from the August issue of the American Journal of Clinical Nutrition. This was the largest study to date on the relationship of strokes to red meat consumption, and it suggests that higher intake of processed red meat as opposed to fresh red meat, it has been associated with an increased risk of stroke, including cerebral infarctions. The study looked at over 40,000 men who had eaten processed meat like low-fat deli turkey, ham, bologna, and actually had an increase in stroke. The investigators speculate that it was the sodium in the processed meats which contributed to the development of hypertension that might be the contributing cause for the higher risk of the stroke and promoting cardiovascular stiffness or oxidative stress. They went on to say that the nitrates used in the preservatives of the processed meat may also contribute to the increased risk of strokes. What I would like to add to this report is that everything we eat that our body doesn't recognize or can't be processed because it isn't natural is going to hurt us. This is a very simple but important concept for all of us to understand. We have remarkable bodies capable of doing incredible things, and it will even try to deal with the fake foods and drinks that we put into it. But in the long run, our bodies are just like any other machine. If you abuse it long enough, it will eventually bog down and start causing you trouble, and it won't be able to support you. It's going to take the nutrients and energy that our body is supposed to have long and healthy life, and it won't be able to do that without processed meat. So remember, you are what you eat. If you eat crappy food, you will eventually have a very unhealthy body and can look forward to a lifetime of disease and pain. We're going to take another short break, but when we return, we're going to welcome back Dr. Arlen Hill and to continue to pick his brain and learn about our gut and how we can all become more healthy. So stay tuned.
Lead paint poisoning affects over 1 million children today. If your home was built before 1978, your kids could be at risk. Log on to leadfreekids.org or call 800-424-LEAD.
Welcome back to Better Health. I'm Dr. Stowe. I hope you saw the last show we did and gained valuable insight into the issues that revolve around an unhealthy gut. During that show, we touched on a condition called leaky gut and another condition termed GERD. But we were just scratching the surface of how the gut can cause so many different diseases. So to continue that discussion and in an effort to help educate our viewers to become more healthy, I want to welcome back Dr. Arland Hill. And as we continue our discussion about the gut and the diseases an unhealthy gut can cause. Dr. Hill is a licensed chiropractor with a master's in public health and specializes in what is called or termed functional medicine. Arland, welcome back.
Thank you, sir.
As a recap, kind of tell us a little bit about what we talked about last time, the GERD, the leaky gut, and what have you.
Yeah, absolutely. When we were discussing this last time, we looked at how the gastrointestinal tract can be so involved in so many different healthcare conditions that are common throughout the entire healthcare arena. It's the gastrointestinal tract gets overlooked a lot of times as being a component in some of these diseases, but when you really look at what the GI tract does and how it handles food, how it has such a strong immune system component to it, it's really easy to see how it becomes linked into these different conditions. And we looked at really what it basically comes down to is leaky gut. And leaky gut is when the gastrointestinal tract has become unhealthy. And the cells in the gastrointestinal tract are not staying nice and tight against each other like they should be, and they're actually starting to more or less start to separate.
So as we age, I see more patients that as they age, they have more conditions, more diseases, and you spoke briefly about autoimmune. So tell us, as we age, why is it our gut is worse off and not doing its job, and how
Sure.
that leads us to autoimmune conditions?
Well, and there's really a couple reasons for that, and it starts, probably most likely it's going to be starting in the stomach. I mean, you could say that as we age, we tend to decrease the amount of protein that we eat in our diets. But it really, even if you're consuming that protein, when it gets into the stomach, we have an inherent tendency to start losing our ability to digest proteins as we age. So when you look at the inability to digest the proteins, and then you couple that with not consuming enough, you're really opening up the door for two things to occur. One is that the gastrointestinal tract, the cells in the GI tract, turn over at a fairly fast rate. So they need energy and resources to be able to repair themselves. And protein is a very strong part of that. The other aspect is that the acid in the stomach acts as a first line defense against microorganisms that we might encounter from our environment, from our food. Mm-hmm. So you're really opening up the door without that first line defense there for those microorganisms to find their way into the small intestine and large intestine.
Okay, so that's some of what we covered last time. So take us now, progress us down. We got the stomach, but tell the audience how the autoimmune conditions, I think you mentioned MS last time as just one. Tell us how the autoimmune conditions can cause MS and how it's related to the gut.
Yeah, and you know, MS is really, it falls under that term of autoimmune conditions, but really probably the bigger ones that we see in our society are going to be the things like the Hashimoto's thyroiditis, so where they can't really control the thyroid levels, and then rheumatoid arthritis. There's many other autoimmune diseases, but those two seem to be the two bigger ones.
Okay.
And really what begins to happen here is that once that gastrointestinal tract becomes unhealthy, it loses its ability to recognize a food or a valuable substance that should cross over into our bloodstream from something that should not. So think about it as being the difference between seeing a food and recognizing a food and being able to take that up and utilize that food, and a bacteria which it should keep at bay. And what happens is it actually loses the ability to say, no, you can cross over, or no, you can't cross over.
And so I've got a 60-year-old patient and they've got rheumatoid arthritis. Mm-hmm. If I'm suspicious that their gut is involved, what do I do? Or if a patient's sitting out there and he's saying, well, my doctor told me it's part of aging. He's listening to us and he's going, if my gut's involved, what do I do now? How do they find that out?
Yeah, well, you can find it out through a couple of different ways. And really, probably the best method to do this is what is known as stool testing. And there's really different types of stool tests. But when you're looking at these testing methods, the ones that really deliver the best information are going to be ones that are looking for genetic-oriented information about the microorganisms that are being investigated. So it's actually looking for genetic material for organisms that might be invading or harboring themselves in the gastrointestinal tract, bacteria, fungus, parasites, things of this nature. These tests also allow you to see how food's being digested. We had mentioned the hydrochloric acid, but you can also look at it from the aspect of the pancreas and the enzymes that are produced from the pancreas, and see if the pancreas is actually producing enough enzymes to break down these foods.
And this is all in a stool test?
This is all in a stool test.
So, I've been to a medical doctor, and a lot of patients out there have been to medical doctors. They maybe aren't ordering these tests, or are they so special that the medical, the allopathic community doesn't know about them, or they don't know what to look for?
Well, I think to some degree that is part of the issue, is that the testing that is available within most standard medicine environments is very limited in what it can look for. You really have to go outside and move towards specialized laboratories that this is what they do. They look for these types of things. The other issue with it is that traditional medicine, in terms of the gastrointestinal tract, is really looking for more of some type of gross dysfunction. So they need to see
blood in the stool.
Blood in the stool. They need to see a polyp in the colon, something. They need to see something gross that they can tangibly work with there. It's really not looking down at that microscopic level most times. And it really, if you're not doing that, you're not going to be able to see the dysfunction, and that's what the stool test allows us to pick up.
So someone they've got rheumatoid arthritis or one of these other autoimmune conditions. The allopathic community, the traditional medicine says, well, here's a pill, you're going to live with it. Pharmaceutical drugs really aren't the way to deal with it.
In most cases, no. I mean, they can be used to help in some situations. I mean, to bring down an emergent situation where you really need to bring the system under control. Mm-hmm. They can be used to help, but really they're not going to be the answer to restore the function back to the gastrointestinal tract.
And that's what we want to do. Is everything about CAM is to restore health.
It really is. And to do that, you have to go back and look at, well, what is it that the gastrointestinal tract requires to maintain its health? And there's a couple of key nutrients that come into play: glutamine, zinc, vitamin A, things like this. But it goes back to things like the diet, making sure that you're taking in a healthy diet. The foods in a healthy diet are actually going to promote the bacteria in the gastrointestinal tract to flourish, as opposed to an unhealthy diet, which is going to make it very hard for them to flourish.
Now, most people would say, well, if it was my gut, my immune system should take care of it. Talk to the audience, if you will. My understanding is that a large percentage of our immune system is from the gut.
It really is. The kind of rough estimates on that go around 60 to 70% of your total
So
tissue.
if you've got a bad gut, then your immune system is
system's
compromised.
weakened. That's absolutely right. It's compromised.
So that's how these conditions can then manifest.
It is, because when you look at this, and we'll go back to the leaky gut scenario, when that leaky gut presentation is present, some of the food particles that become undigested or that are not digested to their smallest levels that they need to be actually begin to become triggers for the immune system. And given that the immune system is a circulating system, it begins to tag these foods fairly quickly. You've got all this what's categorized as lymph tissue right there at the gastrointestinal tract. So you're going to have these lymph cells and these other immune cells that are going to tag these food particles or bacterial particles or whatever it is. It's a non-food or a non-self-recognized tissue. Mm-hmm. It's going to tag that, and the immune system is going to have a heightened response from that.
Tell me, I prescribe a lot of probiotics for people. Talk to the audience about what a probiotic is and what it does.
Right. A probiotic it's a bacteria. And
it's a good bacteria.
It's a good bacteria, and we typically think about bacteria as being bad. And actually, the best example I can give you of this is that we think about when we hear the term E. coli, most people kind of shy back and go, oh, E. coli, that's bad stuff. Yeah, there are bad strains of E. coli, but there's also some beneficial strains of E. coli
Right.
that are resident in our gastrointestinal tract, or that should be resident.
And that's very unusual for most people.
Right, right. But when you look at the probiotics, these are going to be the microorganisms that help maintain the health, especially in the lower colon. They're going to take our high fiber foods, are actually going to ferment them. They're going to provide an energy source for the cells of the gastrointestinal tract. The bacteria are going to have a very protective relationship against other microorganisms, and that they're going to try to outcompete them for resources. So they're pretty necessary to have in our guts.
So one of the things that I do is for patients who are older and maybe having symptoms of GERD, is I'll put them on either hydrochloric acid or a digestive enzyme to help digest and break down those nutrients, and then I'll put them on a probiotic.
Yep.
So for the patient who's out there and they have these symptoms, tell me, because we have a very short amount of time, how is a patient to know if they have a gut condition, and who would they turn to in order to get to the bottom of their condition?
Yeah, I think the first thing you have to do is, do you have any symptoms? So any of the classic things like belching, bloating, reflux-oriented type presentations. Do you get bloated after meals? Things like this. Those are pretty classic symptoms. Diarrhea, constipation, alternating, any changes in your stools, and really if you figure that you have something like that, to try to find help from someone.
But that's what I want. How does the audience know who to turn to? If they can't call you or they can't call me, who do they turn to?
I think the best approach is to look at some of the functionally oriented resources out there, the professional organizations that really try to promote and emphasize functional medicine. The Institute for Functional Medicine, there's an organization named A4M. The American Clinical Board of Nutrition has a grouping of doctors that are very versed in these topics. Any of those organizations would be able to provide a doctor that could help a patient, or that could direct a patient to a doctor that could help them out.
Arlen, thank you so much.
Absolutely.
Folks, when you are watching this tape and you're listening at what Arlen has said, if you have any questions about these organizations and you need more information, give us a call or hit us at our website. There's one more segment in our program, and it's called Ask the Doctor. This is where you, the viewing audience, can ask questions. So let's take one more short break, and we'll be right back.
Any questions?
What kind of service plan does this come with?
Unlimited.
Can I keep my same phone number?
Absolutely.
How do I change the ringtone?
Just hook it up to your computer.
Does it have a camera? What's the warranty? Does it come in silver? Can I put my party shuffle on this? Does it have a 3.5 millimeter headset jack? You sell a lot of these?
It's the one I carry.
You ever get those phantom vibrations in your pocket?
Any questions?
No.
Are you sure?
Yeah.
Ask questions. For the 10 questions everyone should know, go to ahrq.gov.
Welcome back. Dr. Hill has done a remarkable job of explaining how the gut can be the ultimate reason for so many diseases that today's Americans are facing. In fact, we have received several questions from our last show about other conditions or diseases that can be caused by an unhealthy GI tract. Honestly, this part of the program just isn't long enough to cover all the potential conditions and diseases that can be caused by an unhealthy gut. My personal belief is that the scientists will continue to study this, and they will come to find out that the gut, along with inflammation, will be the primary cause of many systemic diseases of our bodies. So with that said, what I'd like to suggest to all of our viewers is that if you have a condition that you are taking drugs for, and you've been taking those drugs for a long time, maybe it's time to find out why your condition needs these drugs. And what is it? What is the underlying cause of your condition? Remember, most drugs cover the symptoms, they don't treat the underlying cause. So I would suggest that you find a holistic doctor that knows the gut and how it relates to many diseases of the body, and start the process of finding the underlying cause of your disease. It may take a while, but the journey will be extremely rewarding. Well, this ends this episode of Better Health. I hope you've enjoyed the show. It is truly my desire to help educate individuals about a variety of conditions and treatment options that exist outside of conventional medicine. I should also state that I am in no way making any type of diagnosis for any condition. All of the comments on the show are for informational purposes only. Any condition that you have or think you might have should be discussed with a qualified healthcare professional. Again, I encourage you to send me any questions you might have regarding today's topic or any other health-related topic you might have. Just send me an email to hcctv@hccs.edu. And as time permits, I'll answer your questions on the air. Until our next show, take care, enjoy life, and live healthy.